Hello, this is Dr. Jaideep Chaudhary, Academics in Nutshell, and the topic of discussion is the wonder drug azithromycin use and misuse. The macrolides as a whole are effective against the gram-positive organisms. It's similar to penicillin like strepto, neisseria, diphtheria, listeria and others. It's highly sensitive against the Campylobacter, Legionella, Gardnerella, Mycoplasma, moderate sensitive against H. influenzae, pertussis, chlamydia and rickettsia. Azithromycin as a macrolide has got some speciality. It has got increased activity against the gram-negative organisms like E. coli, Salmonella, Shigella, enhanced activity against chlamydia, Legionella, Mycoplasma, the atypical organisms, but it has got decreased activity against the gram-positive organisms, staph and strepto, and inactive against MRSA. Azithromycin has got some advantages. It is acid stable. It has got rapid oral absorption, mainly from empty stomach. It has got large tissue distribution and intracellular penetration is also very good. The concentration in most tissues exceeds that of plasma, and high concentration is achieved inside the macrophages and fibroblast. It is released slowly from the intracellular sites with a long T-half of more than 50 hours. Mainly excreted in bile, better gastric tolerance and the convenience of a single daily dose. Azithromycin is frequently used in upper respiratory infection, but we have to remember that the commonest etiology of upper respiratory infection are viruses, strepto, H. influenzae and moraxella, where we have better drugs like amoxicillin or co-amoxiclav. Only if we are suspecting atypical organisms, we may use azithromycin. Otherwise, azithromycin is not the first-line drug for upper respiratory infection. Regarding typhoid also, the first-line drug is cefixime, but the disadvantage of cefixime, it has a long defervescence. So that's why the child may be febrile, but if the child is clinically stable, then definitely we may continue cefixime. Azithromycin, if used in enteric fever, should be at 20 mg per kg for 7 days. It is effective against the intracellular organisms like Salmonella, but it has to be spared for other more important infections where azithromycin is the only drug of choice. Regarding the combination of cefixime and azithromycin, it's absolutely no. So let us be cautious, let us preserve azithromycin because it's still very effective drug against some very special infections. Thank you.